So an ACE score is, again, a set of questions that you're going to answer. The higher your number is based upon that test, the higher your risk for diseases, disorders, syndromes, chronic diseases, chronic disorders, lifestyle factors, all kinds of things. So ACEs can happen. So I know we have the first five, if you guys have heard of the first 5 years of life, is where most of your memories and belief systems, all of that basic structure and foundation of you is created. However, if you've experienced trauma, you may have started in a trauma-based state, and all of your behaviors, memories, thought processes, behaviors, lifestyle behaviors, etc., may have started from a traumatized state, which can create a lot of stress, physically, mentally, emotionally, spiritually, cellularly, socially, etc. The higher the stressors are in these areas, the greater risk you have throughout your lifetime. So adverse childhood experiences can potentially harm and impact your health, including your dental health. So for me in particular, yes, I have the highest score. I have a 10. I'm a 10 and I have a 10 ACE score. So I want you to use that for yourself as well. But stress, it is the chronic toxic stress. So there are different types of stress. There's positive stress, there's negative stress, and there is toxic stress. When you have a higher ACE score, you are usually in a toxically stressed state. When you're in a toxically stressed state, it turns on your fight or flight, it increases your cortisol, and there's no way kind of to turn it off. So it can create all kinds of problems in your life throughout the duration of your lifetime, etc. Regardless of what you do, it increases your risk. But there will be some hope. I'll talk to you a little bit about that at the end. So stress from ACEs can contribute to oral health issues, emphasizing, of course, the importance of holistic care, such as my programs, as well as any other holistic behavior opportunity, support, class, whatever it is that you're interested in. So you want to focus on things that are meaningful to you and something you'll actually complete and continue. So regular dental checkups are going to be best, but a lot of us didn't have that or weren't afforded that opportunity. So there are various mechanisms where an increased ACE score can cause increased dental issues, and I'm going to talk to you about that now. So one thing that we don't really talk about, a lot of people don't talk about, I'm not quite sure why. I know there's a little bit of probably stigma around it, but teeth grinding. So I did not know that I was grinding until I would feel my jaws get sore. So there was a time in my life where I would wake up at night and I would clench my jaws so tightly that is still considered a grind. So I wasn't grinding back and forth per se, but because I was so clenched, I was so stressed, I was in such a stressed state in my life and in my body and in my mind. This was around the time when I was in cult number 2. Yes, 2 cults, y'all. We can talk a little bit about that later, but if you go ahead and join my the T-Spot Wellness, my app, you'll learn all about it and learn a little bit more. Also, my book will be coming out soon. It's called Holy Shit, and I will tell you a little bit about, well, I'll tell you all about what happened and how I survived 2 cults. Chronic stress from grinding. So grinding and clenching at night, you may not be aware of it. It could be when you're stressed. Sometimes when people who have relied on drugs or even pharmaceutical drugs, you can grind or you can shake your jaw a little bit. That's a form of grinding. So it's that stress that is still in your body, the heightened cortisol, the fight and flight stuck on. It's kind of like the way that we have our sphincter that allows us to breathe, but also allows us to eat our food. It's similar to that, gets stuck open, basically. So you're always in a state of fight or flight. So you're always in a state of hypervigilance. You're always in a state of your mind is racing. You think something's going to happen. You just feel that stress in your body at all times. Your cortisol is always high because every experience that you've had, or most of the experiences that you've had, have been stressful. So when you have teeth grinding, it damages the many layers of your teeth, exposes your nerve eventually, or makes it easier to get to your nerve. Your teeth are going to be damaged, they're going to die, increases pain. That increase of pain often can take us to the dentist, but there are things that often can happen at the dentist that further create more complex trauma. I had a lot of that as well. So I've had dentists speak very poorly to me, treat me awfully, like terribly, and nursing staff. Several times I've had to tell people as kindly as I could that they didn't know what I'd been through, what was going on in my life, and which was exactly the reason I was at the dentist, to try to get things rectified. But now I'm being mistreated, which is creating more of a problem. So that's a whole separate discussion, and we'll talk about that a little bit later. So, but creating opportunity to improve your oral health outcomes is going to be the best way for you to rectify or mitigate the damage from your ACEs, as well as create a new life for yourself. I want you to begin to revere your life as a gift, even though we've experienced trauma. So I say we because I've experienced trauma as well. And it took a very long time for me to even decide that I wanted to live, that I wanted to be alive, that I wanted to experience and discover and learn. I needed to belong to myself again, not my trauma. I wanted to be driven by my own desires, my belief systems, not by my trauma. And that is a very challenging place to be by yourself, but it's also a very, very challenging place to be because of the number one thing that keeps us quiet about trauma is shame. Shame that we'll be judged, that we'll be mistreated, that we will be, people will think it's our fault that we were in it. People will think it's our fault that we got out of it. People that will think it's that we drew this kind of behavior to us. A lot of belief systems say that you drew that energy to yourself. There's a whole bunch of and many different layers of shame. One of the worst types of shame is weaponized shame. And I see a lot of that. And it's often challenging, especially being a functional nutrition practitioner, trying to help people understand how to support themselves outside of the greatest next biggest thing, right? The TikTok shortcuts or the Instagram hacks or whatever. When it comes to healing, there's no hack. You have to do the work. You have to take the stairs. But what I can say could be a hack is that healing doesn't start on the outside. It actually starts in your mind. And you can find whatever area works best for you to start with. For me, the area that connected best for me was nutrition. So as soon as I decided I want to take control of my life, I want to heal my body, I want to be my best me. What can I do? Where do I want to start? What doesn't feel overwhelming for me? What's something that I can do consistently every single day? And the first thing that came to me, I need to detoxify my body, and I need to allow that strength, that detoxification to radiate out to every other area of my life. So it started with me on my plate. And I find that that's the best way to start because it's something that you can do with your next meal, right? You can do that with your next snack. You can do that with whatever you reach for, your next drink. You can instantly start to change your life by just taking a drink, eating something different, grabbing something that works better for you, choosing not to eat something that makes you feel bad. That's quick, right? That's quick and easy. I can implement it right now. I don't have to go out and buy anything. Hopefully you don't have to go out and buy anything, but even if you do, you can look in the store. Do I want this or this? Is this going to work better for me, or is this going to work best for me? So for me, my chief belief system was that I didn't want better for me. I wanted what was best for me because I'd already experienced what was better, and it created an opportunity for me to continue to compromise. And I just didn't want that for myself anymore. So I stuck to the belief, I committed to myself to what was absolutely best for me, the absolute best, the best experiences, the best food, the best friends, the best feelings for myself, about myself, the best hair products, the best internal structure to create the best hair for myself, the best skincare products, removing a lot of the toxicity from my body. I literally took that word and broke it down and applied it to myself to create the life that I desired. Any questions, please drop them in the chat. I know I'm getting super chatty. I don't want to keep you very long. I'm not that kind of person. But if we start getting in a conversation, then I want to tell you all the good stuff that I know so that I can help you. So some of the ways that we cope with our ACEs in unhealthy ways are through grinding, like I said, poor oral hygiene, consumption of sugary foods. Let me tell you about sugar. So sugar can create the same response as abuse in our brains. So there are two things here that I really want you to think about. When you are addicted to sugar, I want y'all to know, first of all, I'm not judging you because I literally used to walk around with sugar water. That was the only way that I was willing to drink water. So I would have my little container, not anymore. I would have my container, and because the minimum I knew sugar wasn't the best for me, but what I would do is I would buy Splenda and I would sweeten my water. So I was drinking toxic water all day just to keep myself afloat. Now, what I actually was doing was trying to balance out my stress load. So, what happens when you are a survivor of trauma is you're used to being in a high state of fight or flight and the highest state of cortisol all the time. So, a lot of times you need something on the outside to meet that need for stress. So, I was actually stressing my body with something that my body was craving, a higher stress, in order to keep me at a balanced state. Have you ever had a time where you didn't have sugar? All of my patients, all of my clients, as soon as you detox, those first 3 days, oh my God, what did I do? What am I doing? I'm not doing this. I can't do it. What am I going to eat? I can't go to the store. You have no idea how many times I have had people try to quit on the third day. I'll still make my payments, but I just can't do this. And not even willing to try anymore. There have been several times where I was like, I'm going to extend this because I'm telling you that this part's going to be difficult and I want you to prepare yourself, but I want you to remember why you're here. This is why your why is going to be most important. Please, again, join the T-Spot, Functional Nutrition and Wellness. Join the app so you can be in a community of other healers so that you can understand and feel supported in this process. It's going to be hard. It's going to be challenging, but you know, it's the most important work that you're going to do in your life is reclaiming yourself, not allowing yourself to be driven by your trauma. That's not what you want. That's the reason you're here. That's the reason why you're watching this video. You don't want to be driven by your trauma. You deserve to create for yourself the life that you desire. You deserve to have the things that you desire. You deserve to feel the way you want to feel and experience life in the way that you want to experience it outside of trauma, not from a traumatic response. Trauma responses are exhausting. I know that. So one of my trauma responses that was exhausting for me was the extreme hypervigilance. Checking the door, locking it again, laying down. Did I lock the door? Did I close the window? Is the patio locked? It was exhausting every single place that I went, looking for the exits, trying not to sit with my back a certain way, making sure my back wasn't it's so much work, and it completely takes you out of the moments that we're here for. We are here to live, love, explore, enjoy, indulge, all of those wonderful things. And when you are driven by your trauma, when you are driven by the traumatic experiences that you've had, you miss that. You miss all of those wonderful, beautiful, and brilliant things that you deserve. So sugary foods. So we talked about grinding. We talked about, which is a poor oral hygiene practice. We talked about sugary foods, and then the physiological effects, right? You're judging yourself. You don't want to show anybody what's going on. You don't want to reach out for help. You're being down on yourself because that's all of the things I did. I felt horrible. I knew the experience wasn't my fault, but as an adult, I felt like I hadn't quite created a life that allowed me the opportunity to heal from my trauma financially or invest in my healing from my trauma. And it made me just back away, and it made me feel worse. So it was super challenging for me for many, many years to even speak to someone about it. I knew it was what I needed. I didn't feel empowered to research. I didn't feel empowered to choose. I didn't feel empowered to curate my healing experience. That's what I want you to do. Empower yourself. Again, join the T-Spot so that you can get the tools required, including classes, lists of physicians in the communities that listen, I don't know where you are, but I can get you with some good people. I just recently, we're going to get to it, I flew out of state to have my upper arch replaced because I wanted the best, because I know now that I deserve the best, and you do too. And I want you to know that. So the physiological effects can make it even worse. So the long-term effects of ACEs, of trauma, of these experiences on your mental health, research is still emerging. It really is. And it's challenging. It increases the gray matter. It increases your risk of long-term chronic diseases and disorders. It decreases your opportunity to be able to absorb nutritional density from your foods. You can have the absolute best diet, and because you haven't addressed your trauma, you will still not absorb the nutrition that you're supposed to. So this is why we're here today, getting to why we're here today. So I really want to give you my top 3 things, because even though I had to replace my upper arch, my dentist, Dr. Grant Olson, yay, was very, very, very proud and complimentary of how I was able to preserve my gum health. Excellent gum health, excellent dental health. He kept telling me that. And as a victim of trauma and as a person who is literally getting her upper arch replaced, it was like a mind fuck. Like, how are you saying this? And I'm here because I need you to replace these teeth. And I had to listen to what he was saying to me. I had to hear, without it listening through my traumatized brain, that I did what I was supposed to do. I did what I could do. I maintained my health. I maintained my oral health. I maintained my gut health. I actually didn't maintain it. I made it better. I took the best care of myself because I knew that I had additional needs, because I knew that there were additional things that had happened to me. I had chosen to be the best to myself, even though the experiences that happened to me were not the best. Now, I'm still a little bit swollen, but I am absolutely loving my results, y'all. And these are just my temporary results. So I had an upper arch replacement. The upper arch is completely replaced. I have 6 implants. It was with Dr. Grant Olson of Innovative Dental in Springfield, Missouri. I had the best time. It was the best experience. But psychologically, physiologically, there was a lot of stress and trauma. Sometimes you have to go through trauma again in order to heal trauma of the past. So the difference here is just like that positive and negative stress, right? The damage to my upper arch came out of negative stress, came out of trauma, came out of that level 10 ACE score. However, making the decision to empower myself to learn what procedures was needed, learn what was going on in my mouth, find out what dentists were specializing in the services that I wanted, find out what innovations were available, find out what would be the best way to address it, what would be the worst way to address it, get a first opinion, get a second opinion, get a third opinion, and maybe a fourth, knowing that I deserved the best, created the best outcome for me. I'm so excited. I'm so grateful. And I'm just beaming. I want to help you all do the same things. So I'm going to give you my top 3 daily behaviors. And I'm also going to invite you to purchase my healer package. The healer gives you 10 things that you need to be doing every single day to detoxify your body, get you to the basics of health, and get you to where you need to be in order to move forward in your life, healing your trauma, and working nutritionally to address any of the deficits or all of the deficits that you may have as a survivor of trauma. It's called The Healer. I'm going to drop the link, and I really encourage you to check it out, get into that course, allow me to support you, and please feel free to ask me any questions. So number 1, Juice Plus. Listen, I know you all take supplements. I know you're going to tell me you already have multivitamins. Multivitamins are not what's best for you. So I can talk a little bit about multivitamins, but let me tell you one of the main things about multivitamins. You can absorb a toxic load or toxic level of those nutrients because they've not been, number 1, monitored. There can be synthetic types of nutrients, and then you can also, which are also lab created, and you can also absorb the toxicity from the environment that that nutrient possibly came from. So there's no regulation to protect you from any of those things, and there also isn't any integrity, which is why there's so many multivitamins. Now, this doesn't mean that every multivitamin is awful, but it does mean that whole food nutrition is different from multivitamins, and you need to be focusing on whole food nutrition. That brings me back to the Juice Plus brand. So I'm going to grab them for you at the end and I'll show them to you. So Juice Plus is number one. Well, number two. Number one would be lemon water. Lemon water every single morning is a basic way to detoxify your body. The number one chief concern of a person who needs to detoxify, or a chief issue of a person that needs to detoxify their body and a trauma survivor, is chronic constipation. You can't poop on your own. The reason why you can't poop on your own is because you've dealt with so much chronic stress in your life that you've taken so much shit that you cannot shit. Like you can't take a shit now. So it really is a problem. Please come to my next shit talk: stress, hormonal imbalance, inflammatory responses, and toxins and trauma. That is what SHIT stands for in my program. So we'll talk a little shit to get you together. But one of the number one concerns is you cannot poop. If you can't poop, then you are reabsorbing those toxins back into your bloodstream. As you're reabsorbing those toxins back into your bloodstream, your immune system is already damaged because you already have a chronic stress load. You're increasing that chronic stress load, you're diminishing your immune system, and you will start to develop chronic disease and disorder on top of hyperpermeability. So I'm just going to give you a quick synopsis of that. Hyperpermeability is just what it sounds. Permeability, holes or ability to get through. Hyper, bigger, more, faster, etc. So hyperpermeability means that your gut lining already has tiny little holes in order to allow the nutrients to absorb. Now the holes are at a certain size because only the nutrients are supposed to get through. Now, when you've experienced or have damaged gut, which comes from trauma and traumatic experience, heightened cortisol, toxic stress, et cetera, as well as poor diet and nutrition, the SAD diet, standard American diet, is notorious for creating hyperpermeability, even in a healthy person, right? So when you have hyperpermeability, when you have chronic stress, all of those things I just said, those small holes are now becoming laxed and damaged. When that happens, you're actually not going to only get nutrients, whatever nutrients you can at that point, everything's getting through. So toxins, poisons, all kinds of stuff is getting into your bloodstream. Your body doesn't know what it is. It's sending for your immune system. Your immune system isn't working appropriately because you have a heightened cortisol level. So your immune system is not going to work properly. So you're constantly going to be constipated. You're also going to be chronically sick. You're going to start to develop autoimmune disorders and diseases because your body's like, hey, I don't know what this is. Let me just send the crew. Then they're going to over respond. It's a whole mess. So you don't need to be doing this. Lemon water in the morning, make sure you get your Juice Plus. And then the third thing you're going to need to do is actually taking the time to breathe. You need to take a deep breath. Breathing is going to allow you an additional opportunity to support your body, additional opportunity to detoxify your body, and it's going to allow you to support one of your biggest detox pathways, which are your lungs. It's going to help to reset your parasympathetic nervous system, which is part of why you're in fight or flight or stuck in fight or flight. And it's going to really allow you to remain present and in the presence of whatever experience that you're having. So it'll help you to really understand, wait, I don't want to be in this experience. This doesn't feel good for me. This feels toxic. This is too excited. I need to take a step back. I need to take a break. I need to take a nap, whatever. But taking a deep breath, consciously taking deep breaths, consciously breathing, doing breath work allows you the opportunity to kind of push that reset button and decide what it is you actually want for yourself. So those are my top three things: lemon water, Juice Plus. So with Juice Plus, you need the quad. Let me actually grab it for you. I'll be right back so I can show you. You're also going to need, I don't see it for probiotics, but I usually don't share that one in this first experience. We can talk a little bit about that when you get into the app, because then I can actually show you the only one that I recommend. So the Juice Plus Quad is going to be the omegas, greens. This one is our berry blend, and then the fruit blend. All of these are going to be essential, foundational to your health, to your wealth, to support your mind, to support your body. You're going to ask me what the difference is between this and some multivitamins. These are all food-based. So on the back of here, you're actually reading a nutrition label because this is food. Your body's going to recognize this as food and process it as food. So even if you take this whole bottle and down it, you just OD'd on fruits and vegetables, which, as we know, are not going to kill you and not going to send you to the hospital. You'd actually get full because this is cellular food, whole cellular food. So all of these vegetables have been blended up and ground up, even the skin, which is where most of the nutritional density in all of our fruits and vegetables are, but we don't usually eat them. This is going to fill in those gaps that you're not getting every single day when you don't eat what you're supposed to, or you don't have time to eat what you're supposed to, or many of us don't have the funds to do what we're supposed to. So this is food. This is food to support your body, to support your health, to support your dental health. So there are so many studies that are done with this in regards to dental support. And one of the reasons I know that my gums didn't bleed is because of the Juice Plus blend. So I'm sure of that. And another reason why my doctor was so complimentary of the state of my mouth, the health of my mouth, is because of these products. I know for sure, on top of my lifestyle and my lemon water and all of the other things that I know that I'm supposed to do and I actually do. So that is it. That is all for me. I hope you found something that was helpful. Drop me some comments and let me know what was helpful for you. Let me know if you have any questions or concerns. Again, please put them in the comments. You deserve the best. You absolutely do. Wealth is your birthright. And I hope you have the best night ever. I'm going to get me some dinner because I am super hungry. And I will see you in the next video.